Hello, everybody, and welcome. This is Nurse Eunice with Florida Training Academy. And in this evening's video, we're going to do a practice test on circulation, bleeding control, and anticoagulants. And so, as we do in each of our videos, we'll give you about 10 seconds to receive your notifications. And if you don't have your notifications on, if you're not alerted as to when we go live, I recommend that you do so you can stay in contact with Nurse Eunice and Florida Training Academy. All right, everybody, we'll start our test in 5, 4, 3, 2, and let's begin. So, question number 1. Which of the following blood vessels carries oxygenated blood away from the heart? Is it A, veins, B, capillaries, C, arteries, or D, lymphatic vessels? Which blood vessels carry oxygenated blood away from the heart? Revealing the answer in 3, 2, and if you chose arteries, you are correct. So arteries carry oxygen-rich blood from the heart to the tissues, which carry except for the pulmonary arteries, which do the opposite. They carry deoxygenated blood. And we have great news. Doing a passed your CNA exam. You are so welcome. Congratulations, sweetie. All right, so let's go to question number 2. Which of the following is a primary symptom of peripheral artery disease, or PAD? Is it warmth in the affected limb, muscle cramps at night, intermittent claudication or pain while walking, or edema in the upper extremities? Which is a primary symptom of peripheral artery disease? All right, what do you think, team? Reveal the answer in 3, 2, and yes, it is C. It is intermittent claudication, pain while walking. So PAD is caused by narrowed arteries, reducing blood flow to the limbs, leading to pain or cramping during physical activity. And this is known as intermittent claudication, or again, narrowing of the arteries. So whenever they walk, they get up, their legs are going to start to hurt. Question number 3, and we're dealing again, this video is with circulation, bleeding control, and anticoagulants, problems or medications that most of your geriatric patients will have or be on. So question number 3, what is the primary function of veins? So if arteries carry oxygenated blood, what do veins do? Is it A, carry oxygenated blood to the tissues, B, prevent backflow of blood, C, exchange gases and nutrients, or D, carry deoxygenated blood back to the heart? And Grace and Rose and Danita and Fatu and Chrissy and Nicole, we're revealing the answer in 3, 2, and looks like everybody got it right. It is D. So veins carry deoxygenated blood toward the heart. And again, with the exception of the pulmonary veins, which work the opposite way, they carry oxygenated blood from the lungs. Let's continue, team. Question number 4. What is a common site to check for an arterial pulse? Is it the neck, the wrist, the shoulder, or the abdomen? Think about when you're preparing for your CNA test. What artery do you palpate? What artery do you feel? Revealing the answer in 3, 2, and yes, Carlene, yes, 70, yes, Chrissy, you got it. It is B, the wrist. The radial artery at the wrist is commonly used to check for a pulse as it is easily accessible. Other arteries include the carotid artery, the femoral. So there are different arteries, but if a person's awake and talking to you, you're going to go for their radial artery. If they are unresponsive, that's when you would go for their carotid artery to take their carotid pulse. Question 5, this is important, especially with pediatric patients. So capillary refill time is used to assess which of the following? Is it A, peripheral perfusion, B, cardiac output, C, venous insufficiency, or D, blood pressure? And this one's hard. So I know this one may be a little bit trickier for you. But why do we assess capillary refill? Why do we press on the nail bed to see how long it takes for blood flow to return? And if you chose, I see a lot of B's. I know. It sounds like it would be B, but cardiac output is usually whenever we do capillary refill, it's to monitor peripheral perfusion. So capillary refill time measures how quickly blood returns to the capillary after pressure is applied, indicating the efficiency of peripheral blood flow. And the reason why it's not cardiac output is think about sometimes when someone has a cast and we'll say, hey, you have to check the pulse beyond the cast, because if the pulse is too tight, it's going to constrict blood flow. So not all the time is the perfusion affected due to their heart issue. It could be affected because we have something on the patient that is too tight. So check the capillary refill, and the goal is for it to be less than 2 seconds, 2 seconds or less. If it's longer than that, we have a problem. All right, team, question number 6. Which of the following is the correct first aid step to control external bleeding? Is it A, apply heat to the wound? B, elevate the extremity without applying pressure? C, apply direct pressure? Or D, pour antiseptic on the wound? Ouch. This one is super easy, so we're only going to give you 3 seconds. 3, 2, and that is right. We are applying direct pressure, and if that doesn't work, we can also elevate. So the answer is C. The immediate step to control external bleeding is to apply direct pressure to the wound using a clean cloth or bandage. Question 7. Which of the following organs is at greatest risk of injury during abdominal trauma due to its size and location? Is it the stomach, pancreas, liver, or kidneys? So which organ is at greatest risk of injury during abdominal trauma due to its size and location? Think of somebody who is driving and they get into a car wreck and the airbag is deployed, or they hit the steering wheel. Which organ do you think is going to be most impacted? All right, revealing the answer in 3, 2, and looks like we have one correct answer. I see you, Rose. Yes, we have Rose and Qualzam. You have it. It is the liver, you all. So it is C. The liver is the largest internal organ and is located in the upper right abdomen, making it more vulnerable to injury during abdominal trauma. And don't forget that organ, if it's lacerated, the patient can bleed internally. The liver is a bloody organ. All right, question number 8. How are you doing so far? All right, are we about 50% correct, 75% correct? But question number 8, a patient is prescribed warfarin. What should you monitor closely? A, blood glucose levels, B, blood pressure, C, platelet count, or D, INR, international normalized ratio. And for those of you all who do not know, warfarin is an anticoagulant. It stops the blood cells from sticking together. And so if this person gets injured, they are more likely to bleed. And so your nurse, your lab tech, the doctor will, of course, order a particular lab. The nurse enforces the order to make sure it's done. And then once the blood is collected and analyzed, one of these values is what is used to determine whether or not the warfarin level is therapeutic. If it is not therapeutic, that means the person could be at risk of clotting. If it's too high, that means the person's at risk of bleeding. And so now that you have that explanation, if you chose D, great job. It is the INR. So warfarin goes with the INR levels. Warfarin is an anticoagulant, and the INR is a measure of how long it takes the blood to clot. The INR must be monitored to avoid excessive bleeding or clotting. Next one, team. So for this one, it's not the platelets, but yes, platelets would also be impacted. But specifically for warfarin, we monitor the INR levels. Question number 9. Which type of blood vessel has the highest blood pressure? Think about this. Is it going to be the veins, the arteries, the capillaries, or the venules? The highest blood pressure. Think about when you're taking a blood pressure reading. Revealing the answer in 3, 2, and first of all, Ernest, congratulations. I am so proud of my babies. All right, everybody, revealing the answer right now. And the answer is B, arteries. So the arteries have the highest blood pressure because they are closer to the heart and need to transport blood forcefully to the body. So when the heart contracts, it's kind of like the ketchup. When you're trying to get the very last of the ketchup out the bottle and you kind of squeeze it. That's what the heart does whenever it ejects the blood from the heart into the body. And so it's doing that via the arteries. So the arteries have the highest blood pressure, again, because it's closest to the heart. It's closest to that kicker, that pumper that's going to push the blood out throughout the rest of the body so it can get to the organs and the tissues. Question number 10, which of the following should be avoided in a patient taking anticoagulants? Now, I already told you what an anticoagulant is. So what should this person avoid? Is it potassium, bed rest, contact sports, or antibiotics? Let's see what my smart CNAs and future nurses think. So we have a youngster, we have a teenager who developed a blood clot. And they are now on anticoagulants. And they're talking to you about, contact sports. It is C. Why can't they play contact sports, you all? Because if they get injured, they're at a greater risk of bleeding. So the answer is C. Contact sports should be avoided as patients on anticoagulants are at increased risk of bleeding, even from minor injuries. So just don't think that only your elderly patients are going to be on anticoagulants. You have young people in their 30s and their 40s having strokes. You also have young people developing blood clots. So people may be on anticoagulants at a younger age. Question number, let's see our next question here. Question number 11. Necrosis occurs when A, tissues receive an adequate supply of oxygenated blood, B, inflammation is present without infection, C, arterial pressure exceeds venous return, or D, there is prolonged tissue hypoxia leading to cell death. All right, give you a few seconds to reread that. And while these questions may not be on your CNA test, remember, we need to prepare you beyond the test because when you get out in the hospital or you get out in a nursing home, you're going to find patients who have necrosis, necrotic extremities, or necrotic toes. So the answer is D. Great job, team. Necrosis is irreversible cell death due to the lack of oxygen and nutrients, often caused by ischemia or severe infection. So whenever you think of something that turns black, that means that it doesn't have proper circulation. Sometimes it's just scar tissue and the doctor can go and remove that scar tissue, but sometimes it could actually be necrosis from the poor circulation, the lack of blood flow. All right, question number 12. What is the most common cause of a myocardial infarction? Myo meaning muscle, cardio referring to the heart, infarction is death. So a part of the heart muscle has died. What is the most common cause? Is it A, atherosclerosis in the coronary arteries, B, pulmonary embolism, C, valvular heart disease, or D, congenital heart defects? What is the most common cause of a heart attack? Quasm says AC. All right, revealing the answer in 5, 4, 3, 2, and I can understand why you all say valvular because it says heart disease, but usually if the valves are acting up, the person may have a murmur, but it doesn't necessarily cause their heart to die, to go and for them to have a heart attack. So what causes a heart attack? atherosclerosis or that plaque buildup. So myocardial infarction, heart attack, typically results from the rupture of the plaque, leading to a blockage in the arteries. So make sure you make that note. Not that this is going to be on any one of your CNA tests, but I'm preparing you for life beyond your CNA test, okay? All right, so question number 13. Which of the following would indicate arterial bleeding? Is it A, blood oozing slowly from the wound? B, blood trickling steadily from the wound? C, bright red blood spurting with each heartbeat? Or D, dark red blood flowing steadily? What are the characteristics of an arterial bleed? And I see so many correct answers coming through. Let me do my crazy nurse dance. Yay. All right, team. So the correct response is C, bright red blood spurting with each heartbeat. So arterial bleeding is characterized by bright red blood that spurts in rhythm with each heartbeat due to the high pressure in the arteries. So for this one, we got to apply pressure longer. We can add additional wraps or I can't think of the name, or gauzes if we need to, never taking off the original, because if you do, you can pull off the actual clot if one has formed. Worst case scenario, we can go to a tourniquet if you're outside of a hospital. If you're in the hospital, they have different agents they can use to try to stop it from bleeding, or this person may need to go to surgery. All right, question 14. A capillary refill time of greater than 3 seconds may indicate A, dehydration or hypovolemia, B, normal circulation, C, acute respiratory distress, or D, elevated intracranial pressure. And I will accept 2 answers for this one. A capillary refill of greater than 3 seconds may indicate what? I see A's and I see C's. So I see the answers that I needed to see. And yes, it could be A, dehydration. A prolonged capillary refill time suggests reduced blood volume. So if there's not enough blood flowing, then the circulation is going to be low if this person is severely dehydrated. But also, if they have acute respiratory distress, where if they're not breathing effectively, that too could cause the capillary refill to be greater than 3 seconds. So again, for this one, even though the answer says A, I will also accept C. So great job, team. 15. A patient is on anticoagulants. Which of the following should be a priority when providing care? Is it A, keeping the patient on strict bed rest? B, encouraging the patient to eat more red meat? C, frequently changing the patient's bed position? Or D, monitoring for bruising and bleeding? You're working on a cardiac floor, and 50% of your patients are on either aspirin or a blood thinner. What should you be monitoring for? Revealing the answer in 3, 2, and yes, we're monitoring for bruising and bleeding. That could be bleeding gums, it could be petechiae, it could be strange bruises on their skin. So patients on anticoagulants are at a higher risk for bleeding. So it is essential to monitor for any signs of internal or external bleeding, including bruises. And I mean, if they get bumped a little bit, they can bruise. When someone's starting an IV, they can bruise. So we want to monitor for that, because that could mean that they're at a greater risk for bleeding and that the nurse needs to contact the doctor to get some labs done. Ooh, this one's a good one. Question 16. Gangrene is a severe complication of necrosis, often caused by A, increased blood flow to the affected area, B, obstruction of blood flow combined with bacterial infection, C, overactive immune response, or D, elevated blood pressure in the capillaries. What is gangrene caused by? We rarely hear of gangrene diagnosis in current times, but that was common, a few decades ago. So everybody, if you have a sensitive stomach, the next slide, you may want to turn your head, but gangrene is caused by, yes, everybody, it is B. Gangrene is caused by obstruction of blood flow combined with bacterial infection. So gangrene develops when the carotid tissue becomes infected, often due to a lack of blood supply, commonly seen in patients with diabetes or peripheral artery disease. Question 17, which of the following conditions might require anticoagulant therapy? Is it A, atrial fibrillation, B, hypertension, C, diabetes, or D, hyperlipidemia? And if you're not a CNA, if you're not a nursing student, just take a guess. If you're a CNA, this may be a little bit harder for you to answer. But which condition requires anticoagulant therapy? Like they can't live without it because they're going to form clots. Revealing the answer in 3, 2, and so many of you got it right. Yes, it is atrial fibrillation. The heart's just quivering. It's not really pumping effectively, which gives clots time to form. So atrial fibrillation can cause blood to pool in the heart, increasing the risk of blood clots. Anticoagulants are used to reduce this risk. So if a person starts throwing clots, because we don't have them on anticoagulants, that is when they can have strokes, heart attacks, pulmonary embolisms, etc. So usually if a patient has atrial fibrillation and they're being seen by a physician, they are going to be on anticoagulant therapy. Question 18, what is the primary cause of deep vein thrombosis or DVT? Is it A, increased capillary permeability? Ooh, big words. B, arterial blockage. C, venous stasis, hypercoagulability, and endothelial injury, or D, hypovolemia? It's C, y'all. That's a lot to say. And so revealing the answer in 3, 2, and everyone should get this one right. It is C. So the 3 factors known as Virchow's triad contribute to the formation of clots in the deep vein. So venous stasis, you're letting your patient lay in the bed all day. They're not getting up. The blood is just pooling in their legs. You're not putting on those sequential compression devices to circulate the blood that's just sitting in their legs. So venous stasis, the blood is just staying there. It's going to pool. It's going to clot, aka DVT. Hypercoagulability, they're not on any blood thinners yet. They're not on aspirin. So the blood just kind of gels together and forms clots. And endothelial injury, maybe something occurred, they have an injury, blood isn't circulating well, that can cause a clot also. Question 19, which organ is most involved in the production of clotting factors? Let's see if you remember your anatomy and physiology. Is it the liver, heart, kidneys, or lungs? Clotting factors. Go back to high school. What organ? All right, team, revealing the answer in 5, 4, 3, 2, and I see you, S. Oh my God, and Darlene and Vivian. I see a lot of people have A. And so you all, not only is the liver one of the largest organs in the body, the bloody organ, it also produces many of the clotting factors necessary for proper clotting. So when someone has cirrhosis or they have some type of chronic liver disease, they are more likely to start bleeding. They can hemorrhage. Question 20, which condition is a potential side effect of long-term anticoagulant use? Is it A, deep vein thrombosis, B, stroke, C, hypertension, or D, anemia? So Papa has been taking anticoagulants now for 10 years to treat his atrial fibrillation. What is Papa going to be at risk for? And this one's tricky. He's not at risk of a stroke because we have his blood thin. So if someone's blood is thin, they're at an increased risk of bleeding. And if they're bleeding, what's going to happen to their blood cell counts? That's the hint, everybody. Revealing the answer in 3, 2. Yes, Stephanie's like, oh, okay, D. Yes, it is D. So they're going to be at risk of anemia. So long-term anticoagulant use can cause excessive bleeding, which may lead to a drop in the red blood cell count, aka anemia, especially if the blood loss is significant. Oh, I love you all so much. You're so fun to be with. All right, question 21, team. Let's see. What should a nurse and assistant report immediately if observed in a patient on anticoagulant therapy? Is it an increase in appetite, a sudden nosebleed, feeling of hunger, or difficulty sleeping? How would you know your patient's on anticoagulants? Number one, hopefully the nurse tells you this person's on a fall risk. They're on anticoagulants. We need to make sure you're aware of the CNA, because if this person slips and falls, they're going to have a huge bleed, a hematoma. It is a very scary sight. So everybody, if you notice this, you need to let your nurse know. And that would be a sudden nosebleed. It is B. So a sudden nosebleed could indicate that the patient is experiencing excessive bleeding, a serious side effect of anticoagulant therapy. And again, if you're brushing those teeth, brushing their gums, and they start bleeding, that could be a reason to notify the nurse also. Question 22. A patient on anticoagulants has fallen. What is the CNA's first priority? A, apply pressure to any visible injuries. B, assist the patient back to bed and document the fall. C, notify the nurse immediately and monitor for signs of bleeding. D, help the patient walk to assess their mobility. I see some great answers coming through. Shan, Qualzam, Nicole, Darlene, Vivian. I see 70 and Chrissy. Yes, we have to get that nurse in the room right away. So it's going to be C. You keep them on the floor. The nurse can help you get the person up. So notify the nurse immediately and monitor for signs of bleeding. So patients on anticoagulants are at a higher risk for internal and external bleeding after a fall. The CNA's role is to notify the nurse, monitor for bleeding, and ensure the patient remains safe while awaiting further evaluation. Now, if the question had said the person was actively bleeding, you would be holding pressure while you're waiting for the nurse to come. But this does not say the person was actively bleeding. So you're just going to monitor to make sure they don't start bleeding before the nurse arrives. Question 23. All right, Grace and Sophie and Cynthia's. All right, Anna K, 23. An IV catheter has come out of a patient's arm. What is the appropriate action for the CNA? Is it A, reinsert the IV and restart the infusion? B, leave the site open to air to prevent infection? D, apply pressure to the site with a clean dressing and notify the nurse? Or D, tape the IV catheter back in place to stop the bleeding? If you do D, we're not going to like you. So I see all the right answers. Yes, it is C. CNAs are not authorized to reinsert IVs. Plus, it's contaminated. It's hit the floor, it's touched the bed. Their role is to control any bleeding, maintain cleanliness to prevent infection, and promptly inform the nurse for further action. And you know how we do it here. If you stayed this long, if you've learned anything, go ahead and help a nurse out. Give me a thumbs up. And if you have not subscribed, go ahead and do so, because my goal for this year, everybody, is to have 1 million subscribers. I know, right? That is so cool. And it's because of viewers like you. So I appreciate you. Thank you for helping out Nurse Eunice. All right. So question 24. You observe blood in the urinary drainage bag. What should the CNA document as part of their observations? Is it A, the exact volume of blood in the bag? B, whether the catheter tubing is kinked? C, the patient's last fluid intake? Or D, the color, amount, and any clots or debris in the urine? So you observe blood in the urinary drainage bag. What are you going to do? Revealing the answer in 3, 2, and yes. So was it peach? Was it dark red? Was it just the really like little specks of blood, or were there huge clots of blood? So all that is important. Documenting the color, amount, and presence of clots or debris helps the healthcare team identify the cause of hematuria. Remember, hema, that stands for blood, urea, that means urine, and determine the severity of the condition. If someone has pulled your catheter and they've irritated it, the urine could be really dark red, or it could start forming clots. Let your nurse know right away if either occurs. Question 25. Which of the following should be avoided when caring for a patient at risk of bleeding? Is it A, encouraging fluid intake, B, helping with ambulation, C, using a razor for shaving, or D, elevating the legs? What should be avoided? All right, revealing the answer in 3, 2, and look at all of you safe caregivers. Oh, I'm so proud of you. We are going to avoid using those razors. So using a razor can increase the risk of cuts and bleeding in patients at risk for bleeding, especially those on anticoagulants. You all, I'm so proud of you. I need to know, what are your future video requests? If there is something that you want discussed, I know I have to do part 2 of the medication videos. I know that someone requested a video on infant care, but if you have a question, comment, concern, go ahead and put it in the chat, and I'll be more than happy to answer it and respond. And I appreciate you all so much. For those of you all who have any questions, you can put them in now. And our next CNA video is going to be on my in my online course tomorrow at 7 p.m. So if you are one of the subscribers to Nurse Eunice's online CNA exam prep course, I thank you. And I'll be live in the course tomorrow. But the next time I will be live on YouTube is probably going to be on Thursday. All right, so any questions? All right, so Qualzam, what question do you have a request about medication? Anything specific? And Chrissy, you are welcome. Oh, Paul, you're welcome also. All right, so Qualzam, do you have any specific medication request? I need to do one on syringe dosages. I think you're in nursing school because of the way you're answering these questions. So let me know what your exact request is. Jeanette, you're welcome. Rose, you're welcome. Also about medication that looks and sounds alike. Qualzam, that is a great video request. Oh my, that is really good. Let me write that one down. So sound and look-alike medications. Does anyone else have a request? Nicole wants to know, hi nurse, I'm doing PCT classes. Are there any videos on phlebotomy or EKG? My ECG videos are in my ACLS prep, but it's not 12 lead, but it is recognizing some of the abnormal heart rhythms, bradycardia, tachycardia, the shockable rhythms, but I don't have anything specifically on 12 leads. And yes, I do have a video on phlebotomy. It is in our playlist. So when you go to Florida Training Academy, there is a video on the phlebotomy workshop. All right, let's see what other questions. Qualzam is a certified medical assistant, a clinical medical assistant. So that's why you know so much. And then Chrissy says medical terminology. And you all, I am not the best on EKG. So I would rather defer you to another nurse or another channel. I'm great at ACLS, but 12 lead EKGs is never something I had to do because we always have had an EKG tech. So I do apologize. Everyone's asking for EKG videos. I need to find somebody who specializes in EKG. Now, I do have rhythm recognition. Would you all be okay with recognizing the different cardiac rhythms versus 12 lead EKGs? Because there is a difference. All right, so you all, I have video requests. I will do the rhythm recognition videos. So whether it's atrial fibrillation, VTAC, a flutter, I will do those videos. And then I will also do Qualzam's videos on sound-alike and look-alike medications. Qualzam said he's watched the EKG video and it helped a lot. So you all, you've given me my homework. Hopefully I've given you your homework. We all have things to study, and I will see you all in the next video. I love you and God bless. Good night, everybody.